Hello, my name is Dr. Dana Silver, a pediatrician from Baltimore, Maryland, representing the Maryland Breastfeeding Coalition. I will be lecturing today on an evidence-based approach to banning formula discharge bags in hospitals. This talk and this recording may be used and applied to any hospital interested in this cause. There is a national Ban the Bags initiative. What is recommended is that hospitals no longer provide formula company giveaways such as diaper bags, coupons, and sample formulas. This would be to breastfeeding mothers and babies and non-breastfeeding. The hospital staff would also not discharge infants with any amount of formula. Discharge gifts may be provided if they do not contain formula or formula marketing. This is an example of formula discharge bags which can be given to new mothers in the hospital. When healthcare providers and hospitals hand out formula, they implicitly endorse the product, including that particular brand that is being distributed. Hospitals should market health and nothing else. This project was originally started by the Massachusetts Breastfeeding Coalition. The vision of the Maryland Breastfeeding Coalition and others is to end routine distribution of commercial formula sample packs to mothers at birthing hospitals in Maryland. Currently, all birthing hospitals in the states of Rhode Island and Massachusetts and all public hospitals in New York City are now bag-free. Let's have Maryland be the next state to achieve this status. So, why is now such an opportune time for Maryland birthing hospitals to move on this subject? Well, in November 2012, Maryland's Department of Health and Mental Hygiene launched its Model Hospital Breastfeeding Policy Recommendations. The aim of this is to assist all Maryland birthing hospitals in a quality improvement process to strengthen and improve maternity care practices related to breastfeeding. All birthing hospitals in Maryland are encouraged to become Maryland Best Practices Hospitals or to go baby-friendly. The DHMH Model Hospital Breastfeeding Policy includes the recommendation that hospitals should not accept free formula, advertisements, or formula coupons for use in the hospital or distribution to breastfeeding mothers. By joining Maryland Breastfeeding Coalition's initiative to ban the bag, hospitals will meet one of the recommendations of this DHMH program. There are several studies among different populations which have demonstrated a significant negative impact of commercial formula pack distribution on the success of breastfeeding. In 1981, the World Health Organization Code of Marketing Breast Milk Substitutes was released. It is a global public health recommendation on marketing breast milk substitutes, such as formula, to ensure that these products are used safely and responsibly. This code calls for an end to all free and low-cost formulas within health systems and prohibits promotion of commercial products within health institutions. A randomized clinical trial involving 343 low-income urban women found that the median duration of exclusive breastfeeding for those receiving a discharge pack containing materials designed to be consistent with the World Health Organization Code was 60 days compared to a median duration of 42 days for those receiving the commercial discharge pack. This was found to be statistically significant. The same study found that infants whose mothers received discharge packs consistent with the WHO code had lower rates of rehospitalization compared to those who received commercial discharge packs during the first 4 months postpartum. Banning these discharge bags has also been found to encourage initiation of breastfeeding. A study done with Baltimore WIC mothers found that WIC mothers who received commercial discharge packs were 6.5 times less likely to initiate breastfeeding than those who did not receive the bag. It is not surprising to see that mothers who are most vulnerable are more likely to see a greater impact of the formula discharge bags. This includes low-income mothers, as well as first-time mothers and mothers who have been ill following delivery. WIC women who received commercial formula discharge bags were also 6 times less likely to continue breastfeeding at 7 to 10 days compared to those who did not. The American Academy of Pediatrics recommends exclusive breastfeeding for the first 6 months of a baby's life and breastfeeding with complementary foods such as baby foods for at least 12 months and beyond as long as is mutually desired by mother and baby. There are now several studies demonstrating that mothers who receive formula discharge bags begin supplementing their babies with formula at a much earlier time. 2 such studies are shown here. One found that mothers who received discharge packs with formula supplemented at a mean age of 4.5 weeks, compared to those who just received discharge packs without formula, who supplemented at a mean of 7.1 weeks. Another found that at 3 weeks postpartum, 39% of those mothers who received formula gift packs were supplementing their babies versus 19% of those who had no gift pack. Mothers who received formula or coupons in their discharge packs were significantly less likely to be breastfeeding at all 1 month later compared to those who had none. This was found to be, again, statistically significant, 78.7% versus 90.8%. In addition to the American Academy of Pediatrics recommendations, the United States Surgeon General's 2011 Call to Action to Support Breastfeeding encourages healthcare facilities to establish maternity care practices that are fully supportive of breastfeeding. Stopping the formula discharge bags is one way hospitals can do this. The Centers for Disease Control Healthy People 2020 objective aims for an increase in the proportion of infants ever breastfed to 81.9%. and an increase in the proportion of infants who are exclusively breastfed at 6 months to 25.5%. And as we've seen, again, mothers who receive formula discharge bags are far more likely to supplement and far more likely to discontinue breastfeeding early on. The Joint Commission accredits and certifies more than 19,000 healthcare organizations and programs in the United States. The Joint Commission accreditation and certification is recognized nationwide as a symbol of quality that reflects an organization's commitment to meeting certain performance standards. In recent years, the Joint Commission has added exclusive breast milk feeding in the hospital as one of their perinatal care core measures. So why the fuss about formula? We often hear in the news of recalls of formulas because of contaminants or other problems. Breast milk has many benefits. Just a few of the benefits from breastfeeding for the baby include reduced incidence of acute otitis media, gastroenteritis, severe lower respiratory tract infections, atopic dermatitis, asthma in young children, obesity, types 1 and 2 diabetes, childhood leukemia, and sudden infant death syndrome. For the mother, there is reduced incidence of type 2 diabetes, breast cancer, ovarian cancer, and postpartum depression, among others. There are no studies showing health benefits for formula in otherwise healthy babies. In addition, there's reduced cost to families. Mothers who receive a particular brand of formula in a hospital are far more likely to stick with it after discharge. Brand name formulas cost families $700 more a year than store brands, and yet all formula is regulated by the Food and Drug Administration, so it is comparable in quality. There is no need to spend more on formula if a family cannot afford it. Families who do follow optimal breastfeeding practices could save more than $1,200 to $1,500 a year in expenditures just in the first year alone. In 2010, the Agency for Healthcare Research and Quality analyzed cost savings to families. This just looked at reduced incidence of SIDS, necrotizing enterocolitis, which is a disease in premature infants, lower respiratory tract infections, ear infections, gastroenteritis, eczema, asthma, obesity, type 1 diabetes, and childhood leukemia. They found that if 90% of U.S. families breastfed exclusively for the first 6 months, the U.S. would save $13 billion a year and prevent in excess of 911 deaths, nearly all of whom would be infants. To date, 6 Maryland hospitals have banned formula discharge bags. These are the Johns Hopkins Hospital, Johns Hopkins Bayview Medical Center, Mercy Hospital, Shady Grove Adventist Hospital, Upper Chesapeake Hospital, and the Memorial Hospital at Easton. This again means no formula discharge bags or coupons or samples given out to new mothers. Based in part on how the above hospitals successfully banned the bags, we have developed strategies to implement and drive the Ban the Bags campaign in Maryland birthing hospitals. There are several approaches that hospitals have taken when looking at why to ban the bag and how to ban the bag. Some hospitals have approached the issue from an ethical standpoint, suggesting that their hospital's policies for pharmaceutical companies should be followed for infant formula companies. Hospitals are acting as marketing conduits and agents for infant formula manufacturers. Others have looked at corporate compliance. Is the relationship between hospital and formula companies in compliance with the rules all other departments and units must follow? Some hospitals have spoken with their risk management office. There are no stock control measures for distribution of formula gift bags. If there is a recall, the hospital has no way of informing patients as lot numbers are not recorded. Hospitals could be found liable in these situations. And several Maryland hospitals have looked at it from a marketing approach. This is a great way for hospitals to advertise itself. Some have made their own discharge bags. Some have provided car sun visors with the hospital's logo on it. To date, no Maryland hospital that has banned the bag has reported significant objections from families. Families who do still wish a formula discharge bag can be given a 1-800 number to obtain one. Here are some other proposed strategies your hospital can take in terms of approaching ban the bag. They can form an interdisciplinary hospital task force. They can use presentations such as this one to educate staff on the effects of formula sample distribution on breastfeeding. They can design their own breastfeeding toolkit, review their hospital policy on marketing products, work with their marketing department to design hospital gift packs or other alternative material if desired. Certainly, we know all hospitals want to support breastfeeding mothers, and a good way to do this is through banning the bag. Breastfeeding resources should be incorporated into routine prenatal packages, and documenting of breastfeeding trends should occur. In addition, hospitals can highlight discontinuation of commercial formula sample distribution in your facility's best breastfeeding practices. The Maryland Breastfeeding Coalition would like to thank Dr. Ruth Namayingo for assisting in drafting this presentation. In addition, Baltimore City and Johns Hopkins WIC, the Baltimore City Health Department, Shady Grove Adventist Hospital, Mercy Hospital, Upper Chesapeake Hospital, Johns Hopkins Bayview, Memorial Hospital at Easton, and others. If you desire further information, you can contact the Maryland Breastfeeding Coalition, as well as looking online at the Ban the Bags national campaign and the Public Citizens Infant Formula Marketing Campaign. Thank you very much.